Hi guys, welcome back. In this video we shall be talking about hypothyroidism, hyperthyroidism, the entire thyroid, how are the hormones related and all those stuff, because it's very common that you have heard at least once that okay, some of your family members, your friends, anyone, if someone is having hypothyroidism or hyperthyroidism, they're taking the medication. So what is this what is this thyroid? So whenever we're talking about thyroid hormone, we shall be understanding what is the main function of thyroid hormone. That means what is the function of thyroid, okay? Then only we can understand what is the problem of thyroid. So whenever we are talking about thyroid hormone, in short, the thyroid hormone is having almost all the functions, okay? The entire body will require thyroid hormone. Now, whenever you are there metabolism of fat, that means fat breakdown, you need thyroid hormone. Synthesis of protein, you need thyroid hormone. Now, along with this, to increase your blood sugar level in your bloodstream, you need thyroid hormone. For maturation of the neurons, you need thyroid. Okay. Along with this, your normal growth and development, you need thyroid hormone. For myelination, you need thyroid hormone. Now, what is myelination? That means, imagine you are having a wire, okay, electrical wire. Inside the electrical wire, you are having the copper, and there is a plastic insulation, right? Now in our nerve also we are having an insulation. Now that insulation is made up of myelin, okay? Because our nerve, they always carry electrical charges. To avoid the charge to disperse in the surrounding structures, we need to have a myelin sheet, okay? That myelin sheet is exactly similar working of the electrical wire covering, that is the plastic covering of electrical wires. For the effective transfer of nerve signals, we need a myelin covering covering the nerves, okay? So you can see there's almost every use of thyroid hormone, from your entire growth and development, for your myelin sheet development, from your fat metabolism, you need to break down fat, for production of protein, you need to increase your blood sugar level in your bloodstream, you need myelin. So the list keeps on goes on. And also thyroid hormone, it helps you to maintain a basal metabolic rate. That means if you're not doing any work, you're just lying down in a bed, no activity at all, 100% no activity, still your body is going to release spend some of the energy. Now that is known as basal metabolic rate, okay? So it helps to maintain the basal metabolic rate, okay? So if your basal metabolic rate is very low, you will slowly starting to gain weight. And if your basal metabolic rate is very high, you will be slowly getting to start lean and thin, okay? So let us try to understand what is the entire axis, because this axis has to be very clear in order to proceed forward by using the board. Okay, so we are having the hypothalamus. We are having the hypothalamus. From this hypothalamus, we release a hormone. Known as TRH. Okay, we release a hormone that is known as TRH. From this TRH, this goes and acts on the anterior pituitary. Okay, pituitary is divided into two parts, anterior and posterior pituitary, but mostly we are thinking about anterior pituitary because we have more work with anterior pituitary. Now this anterior pituitary is going to release another hormone, that is thyroid stimulating hormone. This means thyroid stimulating hormone. Now this thyroid stimulating hormone will go and act on the thyroid gland. Okay, is going to go and act on the thyroid gland. Now from thyroid gland you are going to release T3 and T4. Okay, so remember guys, T3 is an active form. Okay, T4 goes to the target cell. This target cell can be anything, anywhere it goes, and then it is converted to T3. Okay, this is the metabolism that we have to understand it very carefully. And remember, from here we are going to have a negative feedback. That means whenever the body is having sufficient amount of T3 and T4, it is going to give a feedback to the anterior pituitary. Hey man, I have enough. You don't need to produce. You don't need to stimulate me more. At the same time, it's also going to attack the hypothalamus, saying that hey man, I have enough thyroid hormones. You don't need to tell the other guys to release thyroid. Now this is known as negative feedback. Once the adequate amount is released, adequate amount is achieved in the body, it is going to tell the bodies to stop. Okay, This is stopping the process. That is the reason it's known as negative feedback. Now another condition, let's say if your thyroid hormones are less, T3 and T4 are less, they themselves are going to give signal to the anterior pituitary and hypothalamus to say release more of the hormones in order for the thyroid gland to release. So this is known as positive feedback. Okay, this is known as positive feedback. So again, we have to understand this structure very carefully, because if we have any problem here, let's say if we have problem in the anterior pituitary, what will happen in the anterior pituitary? The thyroid stimulating hormone will be affected. Thyroid stimulating hormone will be affected means thyroid gland will be affected. Thyroid gland will be affected means we'll be having problem with the T3 and T4. T3, T4 means not present, adequately present. That means if this T3 and T4 are less, we will say hypothyroidism. If T3 and T4 are more, we will say hyperthyroidism. Okay. So if we see the TRH level, there is some problem with the TRH level, that means we will know that there is problem with hypothalamus. That means then all the structures below it will be damaged. Okay. Now if we see only T3 and T4 are less, okay, T3 and T4 are less, then we have to see all the structures are working perfectly or not. Okay. So remember, whenever you are having T3 and T4, TSH is inverse of T3 and T4. That means if T3 and T4 increases, TSH will reduce. And if T3 and T4 reduces, TSH will go up. Because whenever this T3 is less and T4 is less, this thyroid stimulating hormone will give more signal to the thyroid hormone in order to produce more T3 and T4. At the same time, if this T3 and T4 are in excess, that is in normal amount or excess, now this is again going to give a negative feedback to the anterior pituitary, saying that, hey man, stop releasing thyroid stimulating hormone. We don't need any more thyroid stimulating hormone. We're already having an excess. So this is known as negative feedback, positive feedback, and this is the entire mechanism of thyroid hormone, how this is going to work. As I told you, the functioning of thyroid hormone, there is almost everywhere we need thyroid hormone, from development, maturation, nerve, to your fat metabolism, to your production of your protein synthesis you need, to increase the blood sugar level you need. So there is almost everywhere you need thyroid hormone. So that is a very important reason we need to see thyroid hormone. So whenever we are doing a test, okay, we are doing a test which is known as thyroid profile test. We are checking for T3, T4 and TSH. What T3 and T4 we are checking? We are checking free. Okay, we are checking free T3 and T4, because most of the T3 and T4 are going to get attached to the plasma protein. This can be anything, can be albumin, anything. Will go and attach to the protein. Remember, what will go and attach to the protein, that will have no effect in the body. Only the hormones which are free floating, that is not attached to the plasma protein, will be showing some effect. Okay. So what does it mean? Let's say if your protein, due to any reason, you are having very less amount of protein in your body, okay, very less amount of protein in your body, that means this T3 and T4 will be having more free, because they are not going to get attached in the protein. So there will be more in number relatively. So this T3 and T4 activity will go in excess. If you are having some sort of kidney disease, okay, some sort of kidney disorder, that means your body is throwing out proteins. That means any drug, okay, most of the drug that we give in our body is going to go and attach to the plasma protein, okay, and some is going to stay free, and that is the only part of that drug is that going to go and do the action. So if your body itself is having very less amount of protein, so obviously whatever the drug we give you, that drug will be more relatively free as compared to normal giving that same drug to the same person, because that drug will not go and bind to the protein, because there is no enough protein. Okay, so in those cases we have to modify the drug. And also here also, that is the reason you have to know the concept here, that protein, plasma protein. If the plasma protein is normal, so maximum amount of T3 and T4 will go and attach to the protein. Maximum cases, around 99% will go and attach here. Okay, 0.1, 0.2% will be remaining free. That is going to do the action. So let's say if the protein itself in the body is very less, then what will happen? This T3, T4 level will apparently go up, because it is free. It is not going and attaching to the proteins, and the structures, the hormones which are not going and attaching to the proteins, plasma proteins, that will do the activity. Okay, that will do the activity. So in a way, the person will be having hyperthyroidism, right? So that was about the basic understanding of hyperthyroidism. Entire thyroid. Now in the next video we'll be talking about hyperthyroidism, hypothyroidism, what is the symptoms that you know. So let's say a patient is having hypothyroidism. That means he's having less amount of T3, less amount of T4, but the TSH will be going up because it is trying to stimulate the thyroid to release more thyroid in order to compensate it. Okay. So if you are having less amount of thyroid, that is, you are having hypothyroidism. If you are having hypothyroidism at birth only, then you are told that you are having cretinism. Okay. But if you have hypothyroidism and you are an adult, then you are known as myxoedema. Okay, you are told as myxoedema. All right. And if you are having hyperthyroidism, that is your thyroid hormones are more, okay, then you're told, obviously you're told hyperthyroidism. But in some cases, if this thing becomes more complicated, more features of hyperthyroidism, then you can also develop thyrotoxicosis. Okay, you'll find toxic symptoms of hyperthyroidism. Okay, this is the more severe condition, that is toxic thyrotoxicosis. Along with this, there is also development of grave disease. If you are having hyperthyroidism, then you can also develop grave disease. What is grave disease? There has to be 3 parameters have to be checked. Okay, has to be intact. Your eyes will be protruding out. Why it will be protruding out? Because there is fat deposition in your extraocular muscles. Generally, it is morely seen in the inferior rectus. Okay, but it can deposit anywhere. But more common it is seen in inferior rectus. Okay. Now, once the fat has been deposited, it is going to push your eye forward. Whenever you're checking your eye, you see the eye. I'm having the black part here. Now, this black part is covered by the upper eyelid. Okay. Now, this upper eyelid is going to cover your black part by 2 mm. Okay. Now, imagine if my eyes have been pushed from inside, my eyes are going to come out, and my eyes, you can see my entire black portion. Okay. So that is also known as staring look. Whenever you're staring at someone, you're angry, and you're making your eyes big, that is also known as staring look. Along with this, you will be having goiter. Okay, you will be having goiter. Along with this, you will be having hyperthyroidism. So if you are having hyperthyroidism, you are having a goiter, and you are having proptosis of your eyes, then you are said you are having grave disease. Okay. So grave disease is done, thyrotoxicosis is done, hyperthyroidism is done, hypothyroidism in children at birth is done, and at adult age is done. Okay, so now we'll talk in individual topics. What are hypothyroidism and hyperthyroidism? You might be having hypothyroidism or you might be having hyperthyroidism. How do you read the lab values of hypo and hyperthyroidism? Okay, so that's all for now, and I'll see you in the next video. Thank you.